You're about to watch content from the Swiss Journal of Radiology and Nuclear Medicine. Cutting-edge imaging science, real-world clinical insights. Visit us at SJORANM.com.
Is bigger always bad? Evaluating effect of sedation on MRI-based optic nerve sheath diameter measurements in children. Omair Ashraf et al. Audio by paper to audio. Abstract. Objectives. To assess the impact of sedation on optic nerve sheath diameter, ONSD, as measured by MRI in pediatric patients. ONSD is a widely accepted non-invasive marker for estimating raised intracranial pressure, ICP, but potential effects of sedation on its accuracy remain understudied in children. Materials and methods. A retrospective observational study was conducted on brain MRI scans from pediatric patients aged 0 to 18 years. Patients were divided into two groups, those who received sedation and those who underwent MRI without sedation. Bilateral ONSD was measured at a standardized 0.3 millimeters posterior to the globe on axial T2 weighted images. Inter-observer agreement was analyzed, and group comparisons used non-parametric statistical methods. Results. Out of 78 pediatric patients, 38 received mild sedation and 40 were imaged without sedation. The mean ONSD in the non-sedated group was 4.8 plus, or minus 0.3 millimeters, compared to 5.7 plus, or minus 0.4 millimeters in the non-sedated group, p equals 0.02. This difference was statistically significant, t of 68.5 equals negative 11.2, p less than 0.01, Cohen's d equals 2.53. Age-stratified data affirmed a normal increase in ONSD across early childhood with stabilization during adolescence. Conclusion. Sedation significantly influences ONSD measurements on MRI in pediatric patients. These findings highlight the need for careful consideration of sedation status when using ONSD as a surrogate for ICP. Age-related trends further highlight the importance of using adjusted reference values. Introduction. Assessing intracranial pressure, ICP, accurately is critical in pediatric neurology, yet direct invasive monitoring techniques can pose significant risks and are often impractical in children. As a result, the optic nerve sheath diameter, ONSD, has gained attention as a non-invasive proxy for estimating ICP, particularly through imaging techniques like MRI and ultrasound. While ultrasound offers rapid bedside evaluation, its operator-dependent nature can introduce variability. MRI, on the other hand, provides a high-resolution and reproducible alternative for ONSD measurement. However, performing MRI scans in children frequently necessitates sedation to reduce motion artifacts. Sedative agents may potentially alter cerebral compliance, CO2 levels, or cerebrospinal fluid dynamics, factors that could, in turn, influence imaging-based ONSD measurements. Although prior research has examined the effects of general anesthesia on ONSD, there is limited data on how commonly used sedatives impact these measurements. This study investigates whether sedation alters MRI-based ONSD readings in pediatric patients. Materials and methods. Study population. We conducted a retrospective review of brain MRI scans performed at Government Medical College, Srinagar, India, between January 2024 and January 2025. Pediatric patients aged 0 to 18 years were included. Exclusion criteria included prior neurosurgical procedures, orbital pathology, poor image quality, or undocumented sedation status. Grouping. Patients were categorized into two groups. Sedated group, N equals 38, received triclofos oral, ketamine 4, or midazolam 4. Non-sedated group, N equals 40, underwent MRI without sedation. Imaging protocol and analysis. MRI was performed using a 3T scanner. All patients underwent standard clinical MRI sequences, including T1 weighted, T2 flare, T2 weighted, heme-sensitive, T2 GRE or SWI, and diffusion-weighted imaging. The orbital protocol included 2 to 3 millimeters thick axial and coronal slices, post-contrast T1, and T2 sequences with and without fat saturation. Submillimeter heavily T2 weighted volumetric images of the orbits were also acquired. ONSD was measured transversely at 3 millimeters behind the globe on slices demonstrating maximum sheath width, Fig 1 and 2.
Figure 1 summary. This is an MRI image. The image illustrates the optic nerve sheath diameter measurement behind the papilla in a patient who is not sedated. The optic nerve sheath diameter can be observed and measured in the image. The figure demonstrates how the optic nerve sheath diameter is measured using MRI in a non-sedated patient. Figure 2 summary. The figure is an MRI image of a sedated patient's eye region. The image displays measurements of the optic nerve sheath diameter behind the papilla. The optic nerve sheath diameter appears expanded in the sedated patient. This expansion may lead to overestimation of intracranial pressure when evaluating ONSD in sedated pediatric patients.
Statistical analysis. Continuous variables were tested for normality, Shapiro-Wilk. Normally distributed data are presented as mean plus or minus SD and compared using the independent samples t-test. Categorical data were compared using the chi-square test or Fisher's exact when needed. Effect sizes were reported as Cohen's d for group differences and Spearman's rho for correlations. Inter-observer agreement was assessed with ICC greater than 0.8 equals excellent. A p-value less than 0.05 was considered statistically significant. Results. Demographics. A total of 78 pediatric patients were included, mean age 7.9 years, 40 males, 38 females. Age did not differ significantly between groups, sedated. 7.7 plus or minus 3.6 years versus non-sedated. 8 plus or minus 3.9 years, T of 76 equals negative 0.81, P equals 0.42. Sex distribution also showed no significant difference. X squared equals 0.26, P equals 0.61. ONSD findings. Non-sedated group.
Math summary. The mean optic nerve sheath diameter for the non-sedated group is calculated as 4.8 millimeters plus or minus 0.3 millimeters.
Sedated group.
Math summary. This calculates the mean optic nerve sheath diameter for a sedated group, which is 5.7 plus or minus 0.4 millimeters. This value is associated with a t-statistic of negative 11.2, a p-value less than 0.01, and a Cohen's d of 2.53.
A positive correlation between age and ONSD was observed, p less than 0.01, consistent with developmental trends. Inter-observer ICC for ONSD measurement was 0.93, 95% CI, 0.87 to 0.97, indicating excellent agreement. Discussion. Our analysis reveals a statistically significant increase in MRI-based ONSD measurements among sedated children. The difference of nearly 1 millimeters between groups corresponds to a very large effect size, Cohen's d equals 2.5, suggesting that sedation introduces clinically meaningful bias in estimating intracranial pressure. This suggests that sedation, even with non-anesthetic agents such as ketamine or midazolam, may impact ONSD values and potentially lead to overestimation of ICP. The optic nerve sheath is a direct extension of the intracranial subarachnoid space, which allows transmission of intracranial pressure changes into the orbit. Thus, artificially elevated ONSD in sedated patients may reflect transient physiological changes rather than true ICP elevations. Our results align with prior literature confirming the positive correlation between ICP and ONSD. We also reaffirm the known developmental increase in ONSD with age, underscoring the importance of age-adjusted interpretation. Clinically, these findings emphasize the need for caution when evaluating ONSD in sedated pediatric patients. Agent-specific correction factors may improve diagnostic accuracy. Future research, ideally with simultaneous invasive ICP measurements, is warranted to establish a more definitive relationship between sedation, ONSD, and true intracranial dynamics. Clinical implications. Risk of overestimation. Sedation-related ONSD expansion may mimic elevated ICP. need for adjustments, agent-specific effects should be accounted for when interpreting ONSD. Future research. Prospective studies with invasive ICP monitoring are needed to validate these findings. Limitations. This study is limited by its retrospective design, absence of invasive ICP measurements, and variability in sedation documentation. These factors may introduce bias and reduce the generalizability of findings. Conclusion. Sedation markedly increases MRI-based ONSD measurements in pediatric patients, with a very large effect size. This expansion likely reflects transient physiological changes rather than true ICP elevation. Careful interpretation of ONSD values is essential when evaluating sedated children. Further studies are needed to refine imaging protocols and develop correction strategies for improved diagnostic precision.